Hi guys, welcome to our video on sciatica. So I'm Dr. Christian Allard. I'm a doctor of chiropractic. I've been a chiropractor for 25 years, so I've been treating thousands of people for the last 25 years. And I have developed my completely different way to actually treat the body, treat the nervous system, and also how to treat sciatica. What we'll cover in this video is first, what is sciatica, so you understand better what it is, what causes it, but most importantly, how to get better and how we've developed a completely different approach to treating sciatica. Now, you may have experienced treatments with physiotherapy, chiropractic, osteopathy, massage therapy, consultants, MRI, and so on, and you may have gone nowhere. We actually see a lot of those patients. You find yourself in a situation when you cannot actually go to the bathroom, or you cannot control your bladder or your bowels, then it's time to go to the hospital, and that is an emergency procedure. Now, first of all, to understand better about sciatica, let's go through what is the sciatic nerve. So the sciatic nerve is the biggest nerve in our body. It takes its origin in the low back, and it comes down here, and it comes out through the buttock. It runs down our leg, the back of our leg, and then all the way down to our foot. So that nerve is supposed to actually help us feel our leg properly, make sure our leg is nice and strong. Now, sciatica in itself is a symptom. It's not a diagnosis. So when people say they actually have sciatica, they'll have either pain down the leg, they'll have pins and needles, they'll have burning, or they'll have weakness as well to their leg. Now, I've had sciatica in the past, and it is very painful. Now, one of the most important things is to actually understand where the sciatica problem actually comes from. So your sciatic problem could actually be coming from the spine, from the discs themselves. It could be coming from also your sacroiliac joint, which is lodged right here. It could be coming from muscles as well that are actually covering the sciatic nerve. So the right diagnosis is actually very important. The thing is, how do discs actually work? Okay, so discs are actually shock absorbers for the spine, and they actually, when we walk, it goes up and down like that. But most of the shocks will actually be absorbed by the curve of the spine. So therefore, when you walk, the curves will absorb the shocks like that here, and the disc will allow that to happen. But if you actually have an accident, hit, or fall, and the disc collapses like that here and doesn't come back out, then that's when the disc will start to wear. The disc will actually take its liquid through a pumping movement like that here. So meaning that when the disc goes like this, it'll actually get the liquid in, and when it goes like that, the liquid comes out. So it's a little bit like breathing. So you get the good liquid in, like you breathe some air, and then you push it out. If that movement is disappeared, then the disc will only be compressed, and then that's when the problem will actually occur, and the disc will compress and eventually compress your nerves as well. Now, one of the most important thing about when you have sciatica is you want to get rid of it. It is a very painful condition. I've had it myself, and it could keep you from walking properly, sleeping, could keep you from having a normal life. So I'll explain to you how we actually treat it here at the practice, but it depends where your problem is coming from. So one of the treatment we have is called spinal decompression. So spinal decompression is decompressing those discs. So just imagine for a moment that one of those discs has a bulge and is actually pressuring one of those nerves here. It'll be very painful to your leg. So basically, spinal decompression will actually use traction, but it's not the same thing as traction. It'll actually use traction to actually pull your spine for anywhere between 30 seconds to a minute, and then releases it. So it'll start to get the spine and the disc to actually rehydrate themselves. It'll actually help those disc bulges to reduce, hopefully, and get rid of the pressure to those discs. Now, if your problem comes from your sacroiliac joint, you could actually have inflammation right here, like into that joint. That's the sacroiliac joint. If you do have that, we actually use either shockwave therapy or manipulation to actually get that joint to move better. If it comes from the muscles, then we actually use soft tissue therapy, which is either with the shockwave or with massage, and then we get rid of that pressure so that your sciatic nerve can actually start to feel better again. We also use laser therapy. So laser therapy will actually reduce the amount of pain. So it's been clinically proven to reduce the pain, reduce inflammation. It'll actually grow some more blood vessels so that the area starts to actually function better. It'll reduce the inflammation, and therefore it'll encourage the healing as well. Make sure you actually click on our buttons at the bottom of the screen so that you can actually learn more about spinal decompression, shockwave therapy, and laser therapy. Now, if you're ready to do something about it and you're ready to actually stop your suffering, I have an offer that you won't be able to refuse. So basically, for only £47, you'll receive a full examination. You'll receive also x-rays if clinically required, and also one shockwave treatment for the muscles or a massage. The total value of all those services is usually £260. It's only available for the first 10 people who contact us through this ad. So make sure you also watch our testimonials at the bottom of this page, and I hope you enjoyed this video. I'm looking forward to see you. Thank you.